Education and Welfare Committee, January 20th, 2026. The time now is 10 a.m. Invocation, I ask Representative Mary Crawford. Thank you, Mary. Roll call by Legislative Clerk, Miss April Lindsey.
Mary Crawford,
Present.
Laura Harjo King, Charles McHenry,
Here.
Thomasine Osborne, Daryl Proctor.
Here.
Here you got 5 present and 0 absent.
We have 5 present, 0 absent. All business will be official. Next on the agenda will be the approval of minutes.
Chairman, I make a motion to approve the minutes with any changes necessary.
Representative Osborne made a motion to approve the minutes. Do I have a second? Second by Representative Crawford. Roll call vote.
Thomasine Osborne, Daryl Proctor,
Yes.
Mary Crawford,
Yes.
Laura Harjo King. Chair, you got 4 in favor and 0 against.
We have 4 in favor, 0 against. Those minutes have been approved. Next order of business is NCA 26001, a law of the Muscogee Creek Nation authorizing the expenditure of grant funds awarded from the Department of Health and Human Services Administration for Children and Families for the benefit of the Head Start preschool program and appropriating a tribal match. Sponsor, Daryl Proctor.
Chairman, motion for a due pass.
We have a motion of due pass.
Second.
We have a second by Representative Osborne. Discussion. And if you would, please state your name and your department, please.
Can you hear me? Can you hear me? I'm Cora Cameron, the Head Start manager. This is our Head Start award. We received it in December in the amount of $2,969,280. And with this grant, it's a requirement to have a 20% match, a tribal match, and it's in the amount of $742,321. Y'all have any questions?
Questions? Any questions from representatives online? Roll call vote, please.
Daryl Proctor,
Yes.
Mary Crawford,
Yes.
Laura Harjo King, Thomasine Osborne.
Yes.
Chair, you got 4 in favor and 0 against.
We have 4 in favor, 0 against. That motion has been approved.
Thank you.
And this will be sent to BF&J for funding. Next, we have NCA 26002, a law of the Muscogee Creek Nation authorizing the expenditure of the Department of Health and Human Services Administration for Children and Families Low-Income Home Energy Assistance Program funds for the benefit of the Muscogee Creek Nation Social Services Program. Sponsor Laura Harjo King. We have a motion of due pass. May I get a second? Second by Representative Crawford. Discussion. If you would, please, your name, department, please. Thank you.
Hello, my name is Iris G. I'm the Director of Social Services. This legislation is to expend our LIHEAP award. LIHEAP is a federally funded energy program to help citizens or like any member of a federally recognized tribe who live within the reservation and meet income guidelines with an energy assistance payment.
Any comments? Any questions? Any questions from anyone online? Roll call vote, please.
Laura Harjo King, Darrell Proctor,
Yes.
Mary Crawford,
Yes.
Thomasine Osborne.
Yes.
Chair, you got 4 in favor and 0 against.
We have 4 in favor, 0 against. That motion has been approved. Next, we have NCA 26003, a law of the Muscogee Creek Nation authorizing the expenditure of grant funds awarded from the United States Department of Agriculture for the benefit of the Muscogee Creek Nation 2026 Summer EBT Program and appropriating a tribal match. Sponsor, Mary Crawford.
Chairman, I make a motion for due pass.
We have a motion for due pass. May I get a second? Second by Ms. Thomasine, Representative Osborne. Discussion.
Good morning. My name is Katura Bunner. I'm with the WIC and Summer EBT program. This is just giving us authorization to expend our federal grant for the Summer EBT program. I do see a correction in the legislation. Our tribal match was already appropriated at the December session. So today's legislation would just be to approve the expenditure of our federal grant we've received.
We'll get that corrected in final
Yes.
format.
Are there any questions? Any questions, representatives online? There are no questions. Roll call vote, please.
Mary Crawford,
Yes.
Laura Harjo King, Thomasine Osborne,
Yes.
Darrell Proctor.
Yes.
Chair, you got 4 in favor and 0 against.
We have 4 in favor, 0 against. That motion has been approved. Next, we have NCA 26004, a law of the Muscogee Creek Nation authorizing the expenditure of grant funds awarded from the United States Department of Agriculture and appropriating a tribal match for the benefit of the Muscogee Creek Nation Food Distribution Program. Sponsor, Charles McHenry.
Chairman, motion for due pass.
We have a motion of due pass. May I get a second? Second by Representative Osborne. Discussion?
Good morning. My name is Anna Sterner. I'm the Director for Food Services for the nation, and this is just to approve our expenditure funding from the United States Department of Agriculture.
Are there any questions from representatives? Any questions from the representatives online? No questions. Roll call vote, please.
Darrell Proctor,
Yes.
Mary Crawford,
Yes.
Laura Harjo King,
Yes.
Thomasine Osborne. Chair, you got 4 in favor and 0 against.
We have 4 in favor, 0 against. That motion has been approved.
Thank you.
And this will be sent to BF&J. Next, we have NCA 26005, a law of the Muscogee Creek Nation authorizing the expenditure of the grant funds awarded from the Administration for Children and Families Office of Family Assistance for the benefit of the Temporary Assistance for Needy Families, TANF program. Sponsor, Mary Crawford.
Motion for due pass, please.
We have a motion for due pass. Second by Representative Osborne. Discussion, please. Discussion.
Good morning. I'm Lauren Randall, and I'm the Director of TANF. And this legislation is to expend federal funds that were partially awarded back in December.
Are there any questions? Questions, representative online? Not, roll call vote, please.
Mary Crawford,
Yes.
Laura Harjo King,
Yes.
Thomasine Osborne.
Yes.
Darrell Proctor.
Yes.
Chair, you got 4 in favor and 0 against.
We have 4 in favor, 0 against. That motion has been approved. So
But
Next, we have NCA 26006, a law of the Muscogee Creek Nation authorizing a supplemental appropriation for the Muscogee Creek Nation Citizenship Office for the fiscal year 2026. Sponsor Charles McHenry.
Chairman, motion for due pass.
We have a motion for due pass. For a second? Second by Representative Osborne. Discussion.
Chairman, motion to go in executive session.
We have a motion to go into executive session. Second by Representative Osborne. Roll call vote, please.
Darrell Proctor,
Yes.
Mary Crawford,
Yes.
Laura Harjo King,
Yes.
Thomasine Osborne. Chair, you got 4 in favor and 0 against.
4 in favor, 0 against.
Who would you like to stay?
Council and Citizenship Department. In
All right, I was going to ask, is there any more discussion? Legislation here? Audience or online? Not, roll call vote, please.
Darrell Proctor,
yes.
Mary Crawford,
Yes.
Laura Harjo King,
Yes.
Thomasine Osborne. Chair, you got 4 in favor and 0 against.
We have 4 in favor, 0 against. That motion is approved. That will be sent to BF and J. Next, we have NCA 26007, a law of the Muscogee Creek Nation authorizing the expenditure of the U.S. Department of Justice, Office of Justice Programs, Bureau of Justice, Assistance, FY25 U.S. Department of Justice Coordinated Tribal Assistance Solicitation for the benefit of the reintegration program. Sponsor, Darrell Proctor.
Chairman, motion for due pass.
We have a motion to do pass. May I get a second? Representative Osborne seconds. Discussion?
Tina Votra with the reintegration, the grants coordinator. This is for the release to be able to expend the funds we were awarded, and I'm here if you have any questions.
Do you have any questions?
Chairman, I have a question. Within the bill, it says that the grant funds will be used to address current gaps in services. Can you give me a couple of gaps, what you're talking about?
Primarily, that would be to assist with training funds, to assist with in-house substance abuse treatment services, and to meet some of those areas that are in need of that.
Any other questions, representative in the audience? Representatives online? If not, thank you. Roll call vote, please.
Darrell Proctor,
Yes.
Mary Crawford,
Yes.
Laura Harjo King,
Yes.
Thomasine Osborne.
Yes.
Chair, you got 4 in favor and 0 against.
We have 4 in favor, 0 against. Now we come down to other business. We have here from the Secretary of Health, Mr. Sean Terry. Everybody should have their packets. Thank you, Mr. Terry. You have the floor, sir.
Thank you, Chairman. And welcome to all the new committee members. Excited that you're here. I am Sean Terry. I'm the Secretary of Health, and I thought just to kick off the report, I would have my staff come up and introduce themselves for the new members, if you could. So.
Jay, my name's Tim Hicks. I'm our Deputy Secretary of Health, and it's good to work with you guys and looking forward to it. Thank you.
Abby Lee, I'm the Public Health Officer.
Crawford, Chief Financial Officer.
So to get started, for those of you that's not been a part of committee, each month we come and provide you a packet of sort of all of the high-level initiatives, metrics, strategic goals, big project, what all of the updates on our big projects are, and we do that in writing. And we also try to give you a brief narrative of these things as well. So I'm going to open up your packet. I always usually start out by giving a update on what the level of respiratory illness is, usually throughout the nation. You'll have flu, COVID, and also RSV. Last month, we had 213 positive flu tests, 37 RSVs, and 173 COVID tests. That doesn't seem like a lot. It is much, much worse in the last 2 weeks. So it's the express care clinics are full right now. We hit a goal or a record at Council Oak this week. We did 170 in a day. So they start out early in the morning and they've been going all day long. Over on the next page, you're going to see clinic visits volumes. And that's just so that you can kind of track as to how many patient visits that each of those clinics sees every month. We have express care visits. Last month, we did 4,000 express care visits between Mulgee and Council Oak. One interesting note, just so you know, as we're reporting OQEMA numbers, about 80% of our visits in OQEMA emergency room would technically be urgent care type of visits. So if you added that 1,000 onto there, it would be about 5,000 visits in a month. Colonoscopies, mammograms, those are our highest level of preventative strategies that we have throughout the Department of Health. So you're always going to get those reports and then the number of surgeries. We ask each administrator to give you guys just a couple of sentences on what are some of the big things each of the clinics are doing in the month, and I won't read all of those to you. Last month, I reported to you that we started a new on-demand clinic, and where you can go onto My Chart, and there's a section that says check symptoms, and it puts a whole list of symptoms in there, and you go through and you check that. It's very cumbersome. I don't like it, the way that it's working. Because if you check any of the symptoms that you have, it automatically kicks you out and says, go to the ER. And so I'm trying to get rid and take all the filters off of the symptom checker and have the nurse actually do the triage over the phone. We probably have had 1,000 people try to get in, and the symptoms checker kicks them out. So I assure you, we're gonna make this a whole lot easier going forward. But we're trying to get through it. The next page we have is contract health. Might note there was almost 12,000 referrals in December. So we do a lot of contract health referrals every month. You'll see on this page that roughly half of those are Muscogee and half of those are other tribes. So we have in Tulsa and Coweta lots and lots of Cherokees in those areas. So I'll just note that. For our strategic initiatives on the next page, uncontrolled blood pressure, we have dropped in the 2 years that we have built this into the strategic plan. We have cut uncontrolled blood pressure in half. We did have 21% uncontrolled. Now we're down to 10. We have dropped A1Cs of patients that had an A1C over 8. We have cut that from 7.5% to 4.5%. So this is, I believe, the biggest improvement in A1C probably in any time in history. We did that primarily by, we now put continuous glucose monitors on all of our patients that need them. And then also the GLP drugs has taken also another really vast improvement for that. Obesity control is an initiative. Those numbers are kind of hard to understand because really we've not ever tracked obesity numbers the way that we've kept up with it the last 2 years. And so those numbers move up and down a lot. We put a HR page in there for you guys to see that we have a total of 1,600 full-time positions, and it gives you a breakdown and some of our recruiting highlights. On the next page, we have a nursing page. We have an LPN matriculation program. We ask employees who are MAs or CNAs if they would like to apply for the LPN school. We pay for them to go to LPN school. We let them we work 40 hours. They get paid for 40 hours, and they have to agree to stay for us for an amount of time. We put all of the open nursing positions in there. You're going to see 28 open nursing positions. However, we have several that are brand new positions. At Okemah, we're adding 3 house supervisors into the hospital. Since we've added swing bed, our volume there has gone up. And then we also keep a number of positions always open just so that we always have nurses that are applying and that we have them in the pipeline. Then also we have a list of our education agreements that are out there. Public health is something that's been relatively new to the Department of Health. That is going to give you an outline of our accreditation process. And Dr. Lee, I'm going to ask her to come up and give some updates on that periodically for you guys. If you've heard me talk in the last couple of months, we've been really focused on patient experience. I've given you guys a list of things for patient experience in here, and I think that is some of the big things. I also have the capital projects for Sapulpa Clinic, Holdenville Clinic, the Mulgee joint venture, and our assisted living center in Okemah. So we're getting really close to getting that project. Just real briefly, I wanted to talk to you guys about the Oklahoma Rural Health Transformation Program. Oklahoma has secured $223 million for the first year of a 5-year grant from the federal government. We were unsure if the tribes were even going to be eligible to participate in it with the state, since we all know what our relationship with the state is. But during intertribal, they came out and announced, that the State Department of Health announced that tribes are going to be eligible. They recognize that we provide the majority of rural health care throughout Oklahoma, and that's really what this grant's about. Last week, I met with some of the volunteer fire departments out of Hannah, some of the folks in the southern part of our reservation. And if you really look from Eufaula to Wewoka, there's a desert of emergency care that's in that area. I've asked Dr. Lee to start putting together, we're going to put together a task force. We're going to go out, I think there's 14 volunteer fire departments that are in that district out there. And what we're going to do, there is a category called expanding care, community paramedicine and funding. There's $31 million available in the state for this program. I want to put a coalition of all of these volunteer fire departments, and then we're going to look at seeing if we can expand our EMS program to where we can start putting ambulances out in these rural fire departments and getting emergency care out there. If you go from Hannah, Wewoka, there's a lot of these areas out in that desert that it's about a 30-minute response time at best if you for an ambulance. So I know that's something that all of you probably heard about over the years, and I think that we want to go after this money to do that. But that's sort of the highlights that I've brought for today, and I'll happy to open the floor up for questions if you guys would have anything you want to talk about.
Representative Osborne.
Thank you, Chair. Mr. Terry, I just have a couple questions. Based on the number that you brought before us regarding urgent care, have y'all talked about having an urgent care in Okemah?
We've tried it and in the past, and patients were confused about where do I go for urgent care versus where do I go for the ER. If the ER wasn't busy, they would go down there. It just was clunky. And so having it in that same building, you know, it's just worked out better the way it is. I'm not saying we can't address it. To be perfectly honest, I would almost rather look for an alternative site to build express cares like we have in Okmulgee. It doesn't sit right in the campus. And so I would be open to trying to put these smaller urgent cares probably closer to where some of these folks live is what I would be more inclined to do.
Okay. The next question I have is, you mentioned the telemedicine to us last month, and you addressed it earlier. Is there a difference between telehealth versus telemedicine?
No, not really. When you get into these categories, our telemedicine program for this on-demand is going to be really like an express care. And so you're not going to be doing any chronic management. Today, we do telemedicine at several locations like neurology. And you have neurologists and they're doing face-to-face visits. This will be really more of sinusitis type of issues, little express care type of things. And then she will say, well, I really need to put in an order for you to go to the clinic and get labs, or you need to go to the clinic and get an x-ray, or we need to do a follow-up. So there's not really any difference. I would just say that the level of what you're providing there's a little different.
Thank you for clarifying, because, you know, I texted you while I was at Holdenville.
Yes.
And I was posed that question, so I appreciate you clarifying for me.
Yes, ma'am.
Thank you.
Thank you, Representative Osborne. Any more questions? Any questions from representatives in the audience? Questions from representatives online? I would like to ask a question, Mr. Terry, if you could give us an update on the facility in Muscogee, rehabilitation.
So we're about 2 months from completing the inpatient. And so construction's going well. We'll probably have a operations meeting in the next couple of weeks. We've been reaching out to partners like Oklahoma State University, who also has a program for inpatient addiction. And what I want to make sure is what happens when something goes wrong at Muscogee. Now, since this is our first go-around into this kind of business, I don't know that we have a great backup plan. And so I'm hoping that we can partner with Oklahoma State to be that backup plan. So we're getting that ready. But I think we're gonna start out with 8 men, 8 women on those floors. And it looks really good up there. So we'll be doing a ribbon cutting as soon as we get construction.
Another question. Will this be rehabilitation only? So before they come, will they have to be admitted to a detox?
They will. So there's, in order to do medical detox on site, you have to license the building as an acute care hospital. This building won't be licensed as an acute care hospital. It's going to be licensed as a residency program. So we have to up our game if we're going to do it as acute care. We could do that in the future. However, the Wagner City Hospital specializes in medical detox. So we've been meeting with their CEO, Jimmy Leopard, and we're going to have an agreement where those patients can detox at Wagner and get straight over to Muscogee. And I think that's the short-term plan until we get it figured out.
Thank you, sir.
Thank you, Chairman.
Thank you. Next, we have Chief Financial Officer, Ms. Brenda Crawford.
Good morning, Chair and members of the committee. I wanted to first start out by leading you to the last page of your packet. But in the last page is a summary of all of the types of funding that we have. We have grants, we have Indian Health Services, indirect, third party, and then we have the tribal opioid funding, which is primarily for the Muscogee facility. As you can see, most of our funding is in third party. So third party represents all of the billing and collections for services that are provided in the hospitals and clinics. So this is just for billing of medical services. And it represents the amount of money that we expect to receive. So at the time of service, the revenue is actually booked to the facility. So if the patient is an inpatient and they have room and board and they have lab and all that happens on that day. Then at the time of billing, after the patient is discharged and at the time that we bill, that's when we post what we consider the amount that we will not receive, the contractual adjustments. So with Medicare, Medicaid, commercial insurance, they all have an amount that they will pay. Depending on what that service is, depending on what that contract is, there's an amount that they will pay. So we take actually in Epic, it takes the amount of the billings less the amount that we expect to pay, and that's posted as a contractual adjustment. Then when we receive the money, that is trued up. So if we happen to receive more or we receive less, we true that up. If we receive less or more, we're looking at why is it different from the contract. So that's how net revenue is booked. It is the amount that we expect to receive. You may notice on the top line, the grants is showing a loss. That's just a difference in what hasn't been drawn down yet. So we have our expenses and then those are submitted and finance draws that money down. It's a timing difference. IHS, we did receive our funding for FY26 in the month of October. That amount plus what we received in November brings the revenue so far to $72.3 million. Throughout the year, we will receive additional funds for CHEF. That is the amount for contract health of their catastrophic services. So if we have a patient that's in the hospital and they're in for a long time and it meets the catastrophic categories, then that amount is billed and we receive additional funds for those cases. The other thing that we'll see during the year for IHS is contract support cost. There's been ongoing litigation regarding contract support costs, and there was a Supreme Court case ruling last year regarding that they had to include third party, the amount that we paid for third party services, amount that we paid our employees. Because before they would only include the IHS salaries, not third party. Well, we all know there's not enough IHS funding to support all of our services. And so that was a ruling. And so there's been ongoing back and forth about, okay, how many visits did you have that were non-native and back and forth. And so we will receive additional contract support costs throughout the year, but we did receive our primary funding in the month of October. If you look at the second portion, the collections, you will see that there's been a significant increase over last year. A lot of this has to do with the fact that there's additional services being provided in each of the clinics and in the hospitals. I would like to highlight just the Council Oak Clinic and just point out a few things to you. There has been additional services that started either at the very end of FY25 or started at the beginning, and that's women's health started there, vascular lab, a nephrology clinic, and then it's on-demand, which Mr. Terry was talking about, the on-demand services. The other things that have been all along but are showing a significant increase is as we've increased the number of clinics, our pharmacy has increased. And I'm talking about just the Council Oak Pharmacy, not the refill center. The Council Oak Pharmacy has received 142% increase over the last year in the amount of gross revenue. Primary care, as we've added additional primary care providers, that's 145% increase. Chiropractic is a 210% increase. And then I guess just overall, Council Oak is an 84% increase. I won't get into all the different, stand here and talk about increase percentages, but I just wanted to highlight the Council Oak Clinic and answer any questions if I can.
Any questions? Any questions from representatives in the audience? Any questions from any representatives online? We have no questions. I would just like to make a comment. Thank you guys for your reports. Very informative, and I appreciate it. Thank you, Ms. Crawford. All right, next order of business, we have announcements. Are there any announcements from our representatives in the audience, online or in person? No announcements. Next, we go to adjournment, benediction, and I'd like to ask Representative Laura King Harjo for our benediction, please.
Gracious Heavenly Father, Lord, we come for all that you do, fighting for our dear Lord, just thank you. Praise you, Father. Thank you for the opportunity to rely upon you. All decisions. Lord, we love you. Thank you and praise you.
Adjournment at 10:45. Hello.